Welcome, I'm Doc Jen.
And I'm Dr. Dom.
And we are coming at another PT Pro from the Optimal Body Podcast, this time on wrists.
So when we're talking about the wrists, there's a lot of common injuries or diagnoses we may hear. You know, you can hear about carpal tunnel. You can hear about just wrist sprain or wrist strain. Another kind of popular one is TFCC injury, which is the triangular fibrocartilage complex, which is this really big, dense cartilage complex that just helps give our wrist some stability, right?
On the pinky side of the wrist.
Kind of on the pinky side of the wrist. People have injury in that. And so why do we develop some of these injuries? Oh, another one is like getting a cyst in the wrist, or people develop these cysts kind of in the wrist joint. So why do we get these injuries, and what can, you know, be some ways that we address that?
Yeah, so we actually showed a really good example of this topic in our first PT Pearl, which was on mobility.
Yeah, because I think where a lot of it comes from is us, especially during exercise or when we're using our wrists, allowing our wrists to kind of smash into ranges that we just don't actually have control in. So we're really just resting into that wrist joint, which can put a lot of strain on muscles and also put a lot of strain on the joint itself.
And not only do we lack control around the wrist, we might lack range of motion. And so if you think about it, the reason we also come back to wrist when we're talking about different mobility is because if I'm going to be in a push-up or plank position, if you think about the angle from your hand on the floor up your arm, it's a 90-degree angle. Now, how many people can actually put their hand flat back without anything, just out, like your hand just hanging out? Can you actually bend with straight fingers too? Because that's what you do on the floor. With straight fingers, can you bend your arm or that wrist back into a 90-degree angle? And if you can't, or if it's like severely limited and it's like only going back a little bit, imagine now putting your hand on the floor and saying, oh, but it's fine for planks and push-ups and everything.
It's fine to put almost my whole body weight through it.
Exactly.
So the wrist is a really, really mobile joint by nature because it can move in all the directions. You know, if you just have your palm up towards the ceiling, you can kind of tilt your hand towards your pinky. You can tilt your hand towards your thumb, flex the fingers up towards your, forearm or towards you, extend them down towards the floor. And then you can pronate, which is kind of like putting your hand then towards the ground, or supinate, which is like putting your palm back up. So it moves in all these different planes. So I think naturally sometimes we just use that wrist to gain extra motion, even where we might not have it or where we might not be able to support in it. So if we realize that, hey, we're not able to get that active range of motion, how can we go about starting to develop this range of motion and develop this support at that wrist joint?
So that's where it's just it's becoming more aware and being okay exploring different ranges within your wrist. Because if you even notice doing those ranges of motion that you talked about right now, you might notice like, oh, it actually feels really tight, or it hurts maybe to go one way, or I am super limited, or I'm restricted. Or maybe even if you extend the arm straight and then you kind of bring the palm up toward, or the back of the hand up toward the forearm, or you bend it the other way and you pull, you might notice different strains and pulls at the elbow too. And so this is where it becomes so important to realize, again, we're going to talk about this a million times, I'm sure, how the body all works together, right? Because the muscles that support us around our wrist actually connect all the way from our elbow all the way down into the fingertips. And so that's where it becomes so important not only to work on this range of motion in the wrist, which we've shown a million times on different platforms on Instagram. It's all in the mobility method, but also to work on strength all the way down into those fingers. And up into the elbows. So bending the elbows, bending the fingers, grip exercises, exploring range of motion, and exploring strength becomes so incredibly important. We like to say one of the quick tests, we'll do it again because why not?
Let's do it.
So we did it in the Mobility PT Pearl, but we'll do it in this one. This is where you bring your forearms together and hands together like a prayer. And then what you're going to do is keeping the forearms together the entire time. You're going to try to roll the fingers down, so kind of let them bend, and then roll the hands up and out so that the palms go straight up to the ceiling, and then extend those fingers out straight as much as you can, and then see, can I make a straight line? Hey, that's actually better. Look at that. You're getting more range.
Better. I'm shaking.
But the goal is to honestly have it like a T from the forearms up out through the fingers and the hands. And that should be like, oh, now I have adequate active range of motion on my wrists. Now I know that when I support into that range of motion in that 90-degree angle, I'm not going to be increasing, this insane amount of load on a range of motion that I cannot carry within my body.
So that's where we'll talk into doing some passive stretching, like you're putting your hands together or on the ground where you're on your hands and knees, kind of hands flat on the ground. You can turn them around so your fingers are facing you, and then straighten out those elbows so your hands are on the ground and you're kind of stretching into the front of that forearm.
Yep.
Then after that, coming and trying that again, so then you'll actively be supporting into that range. So of course there's progressions to get there by passively doing some type of mobility stretch and then actively kind of supporting through that range.
And that's why even if you start to put pressure into the fingertips, like Dom was talking about in that push-up or in that plank position, in the handstand, you're also putting like an active force into that stretched muscle, which actually helps as well with increasing that mobility at the wrist as well. So, and then when we pull open, we're actually activating the back side of the wrist. So when we do that at that test, or we continue to do it over and over again, we increase the strength to really use that wrist and get into that extension. So we're using what are called the extensors, or just the back of the hand all the way up into that elbow. And when we then start to make it strong on the front and the back, and we're increasing that flexibility of the muscle in the front by doing a passive stretch, we help to then gain that initial range of motion, which is the place that we have the most range in the wrist, which is flexion and extension. And if we can start there, we automatically help to unload the wrist, to decrease your risk of injury, and to be able to support, especially when we're talking about exercising and getting down on the floor and using those hands.
Like you said, when you really increase range in one plane, or being that flexion and that extension, we automatically give more slack to the system to then start to explore the other ranges, which would be those side to side motions, which we call ulnar and radial deviation. That's just meaning going inward toward your pinky or outward towards your thumb, and those pronation, supination motions. So again, once we start getting maybe good at doing some flexion and extension, other ways that we can explore putting support into the wrist, like go grab a bucket of rice.
Yeah.
If you have a big bag of rice that's been sitting in your cupboard for forever, dump that into a big bucket, especially if it's your parents, make sure it's okay with them or something. And then just start kind of digging that hand into that rice and moving it and gripping and rolling and rotating that wrist and feeling, oh, there, I'm a little bit restricted. I feel a little bit restricted in that direction. Work into that.
Or it gets super tired. Like the other thing you'll notice is, like, if you start doing that grip and rotate, you might notice like after 5, it's like, oh my gosh, I'm super weak. It gets so tiring so fast when you haven't used your wrist in those ways.
Yeah. Another thing that we want to always keep in mind when we're talking about the wrist and the hands, some of the symptoms or the diagnoses that'll come up can be a product of, like you said, what's happening up at the elbow, or even what's happening up at the shoulder and the neck.
Yes.
Especially when we're talking about the nervous system. Our fingers and our wrist and our hands, that is the very end of the nervous system in our upper body. So if there's anything kind of happening along the stream or upstream where the nerves come out of the neck, through the shoulder, if we're compromising a little bit and causing tightness in certain areas in that nervous system, or down through the elbow, that can cause some downstream effect on how the hands are feeling sensation-wise, strength-wise, or even some of that mobility in that range. Again, depending on how we're using our shoulder and elbow, we can then feel some different symptoms throughout the fingers. So being aware of tightnesses around the neck and the shoulder, could impact some of those symptoms at the wrist.
100%. And that's why, especially when we're talking about like carpal tunnel syndrome or anything like that, you might notice numbness, tingling going down into the fingers, or say that you're falling asleep and you always wake up and you have a hand that's asleep. You know, we cannot just look at this area and say, oh, let me massage out, you know, the tissues right at the wrist, because it could be coming from a little bit higher. And we need that mobility even in the wrist. So, or I mean, even in the muscle tissue. So that means that that nerve needs to be able to glide and slide, almost like flossing through that system, flossing through the connective tissue, through the muscle tissue, where it's not getting clamped down on so hard and being restricted in movement. When it gets clamped down, you can almost imagine like that's how it starts to get kind of pinchy, and numbness and tingling, burning sensations, those things can happen. But what I will say about the nervous system is that it is a little bit more delicate than our muscle tissue. And that's why working with a trained professional like a physical therapist, there's a lot of different little tiny progressions that we use as therapists that make a really big difference in how your nerves are responding and how they start to move and decrease that sensation of burning, pinching, or tingling or anything like that. And that's why I don't show like a ton of exercises actually on my social media or anything on nerves, because it depends. And if you are feeling those sensations, I just want to re-emphasize like seeing a trained professional where we actually learn so intensely how to really work with the nerves in the body. Go see a physical therapist. Like, it is 100% worth it to change the way that nervous system is responding and improve the neurodynamics happening in the body.
I think that gives us a good idea of different things that we could be feeling around the wrist, and just some different ways to approach those movements, gaining passive range of motion, learning to actively, support through that range, and understanding that, of course, what's happening up at the elbow, shoulder, and neck can be impacting the symptoms at the wrist.
You'll notice a difference if you're active within your entire body. Also affects how you are at the wrist. So say I'm in a plank and I'm like, okay, I'm going to push into my fingers now, right? Because that's going to help to activate a little bit. But what if you also push into the fingers and then thought about the shoulder blades and actually pushing the shoulder blades into the ground? So think of the shoulder blades protracting. You don't have to know exactly what that word is, but think of trying to push those shoulder blades away from the spine and forward into the ground. When I do this, I actually increase my scapular control. I lift my chest off of the weight that's going forward and down into my wrist, and I help to increase that core activation as well. When we get that whole body to kind of contract and work as one with the fingertips pushing into the floor, you will notice a world of difference of the tension going into the wrist when you're holding. So you don't want to feel all the tension at the palm. If you're on your hands, you want to feel it into your fingertips, you want to feel it in your shoulder blades, and you want that core to really be active. That's how you'll know that you're really supporting yourself. And so, yeah, we're not talking about one diagnosis. We're not talking about one fix, because it's never like that, guys. Like, I think that you're starting to hear us repeat a lot of things over and over again. It takes work. It takes consistency. It takes exploration. It takes assessments. And it takes getting to know your body and being willing to move into your body.
All right. Hope you enjoyed that PT Pearl on the wrist and some wrist diagnoses and a couple ways to approach that. So if you liked it, subscribe, comment below. Let us know what you want to learn. We still need more topics. We're always going to need more topics, because we're going to keep bringing you these pearls to help you move into your optimal body.